So yeah, these erector spinae mostly work in extension. Now the thing is that we are not particularly because of how much the spine moves and because of the way that it's structured, we don't want to really load too much into basically flexion and extension too much, right? We play with it all the time, but we have to be really careful with that because the main job of any of these muscles that we've talked about is to stabilize the spine. And a lot of times what happens when people start feeling tension in their spine, they feel like it's tight or they're having back pain, it's because these muscles become overactive and tight. And again, there's many reasons why that happens. One of them could be that, if you suddenly have a tight psoas, there might be something in this area of your back that your back feels unstable, and so that muscle is tightening up because it's trying to deal with that stability issue. Now, this is one of the areas where, if you can't identify it, that doing a yoga session that does everything as far as your spine goes will actually make you feel a lot better because you're actually addressing all the things that could be tight and getting all into a neutral position, and you're hopefully getting rid of that overactivity that's causing back pain. But that's not the only thing that happens with back pain. So since I think we've mostly covered everything I wanted to talk to as far as core musculature goes, I've got one more thing to add, which is going to be, two things to add actually. So all these transverse muscles, and I mentioned this a little bit earlier, go into what we refer to as the thoracolumbar fascia, right? So it's a big tendinous tissue that goes and feeds into the spine, and most of the muscles that go around your body are going to feed into that. Included into those muscles, and this is what actually makes them core muscles, just like your psoas feeds into the low end of the spine, your mid-spine, lumbar spine is going to also have attached to it this muscle. Okay, this is your latissimus dorsi. So this is when you're doing a row, when you're doing a pull down, anything that basically pulls back and down like that, that's going to be predominantly your latissimus dorsi that's going to be doing that movement, and it feeds into this thoracolumbar fascia. So if you think about it, if I'm doing like the dishes a lot and I'm in this position, that latissimus dorsi might feel unstable, or it can feel overstretched and it wants to kind of go back into a more neutral position, we can actually start to feel tension and tightness right throughout here. So it's going to be partially because of that latissimus dorsi becoming overactive. It could also be a little bit of those erector spinae, a little bit of the multifidus muscles that are trying to pull you back into a more neutral position, and that might be part of the reason why you're starting to feel tired and strained when you're in that position. Now, what I kind of want to talk about really quick here is actually the spinal structure, because I think this is a really important thing to know. Now, in all your joints, you have a couple things that are going to help cushion those joints, lubricate those joints, and make them allow them to move quite a bit. And in most cases, what you have is cartilage that's going to cap the top of your bone so that it's a little bit less abrasive, it moves a little bit more fluid, that's going to allow that bone to glide over its other bones. What you also have there is little sacs of fluid, and so if you get bursitis, it's a rupturing of these sacs of fluid that lubricate those joints, and then you get like a big amount of bruising. I have had it before from trying to triangle choke somebody. And you get this big rupturing of that synovial sac. You'll see a lot of bruising there, and it's a really bad thing to get that kind of bursitis because you lessen the ability of your body to lubricate that joint, so that joint's going to wear out faster. Okay, and that's another reason why being overweight or doing things like leg extension, leg curls, or things like that are not necessarily a great idea, because it wears down those that cartilage and those synovial sacs so that they no longer can lubricate the body, and then you're going to have issues there. Not to mention the ligaments and tendon issues that you're going to develop from doing those particular movements. But so if I do a really shitty depiction of the spine here, right? So that's enough there. The spine, as you know, is predominant function besides just structuring your body is going to be housing your nervous system, right? So you've got your spinal cord when it goes out there, and then you have all these like little nerves that shoot out in all directions from your spine. Now, inside your spine, you have little discs here that are going to basically be supporting your spine and cushioning it so it doesn't get too compressed. It's not going to cause discomfort. It's not going to wear out really quickly. So these are kind of little maintenance pieces here. Now, if I take on a position, right, that looks like this. Now, this could be from any view, right? This could be, looking at from the front. You could be looking from the side. So if I pick up something like this, right, and it's really heavy, and I'm really starting to come up, even doing that right now, making that big show of it, I felt uncomfortable tension there, right? But doing that kind of lifting from the side, what's happening is that this side of the spine, if I move laterally, is happening just like that, right? If I lift down and pick something up with a rounded spine, this is going to be the anterior portion, or this is the anterior portion of the spine, this is the posterior, right? So whatever you're doing, hypothetically you could go the other way around, right? This can happen in any direction, is that this cushion, right, will be forced out, and then it will sit here. And once you go back to that neutral position, right, so I'm here, right? Once that pad gets moved out and you restack, basically your bones come together and then they prevent that pad from going back in. Thus you have a herniated disc. And what happens, because we have all these nerves around here, right, this pad is now pushing on those nerves. And so what you're going to start experiencing there is you might get numbness, tingling, and shooting pain that goes throughout your body. So that's one of the reasons why it's really important to always lift properly with a neutralized back. And I've talked about this in some of the workout videos that if I'm doing a deadlift, I'm going to finish by squeezing my glutes and tucking my tailbone under because I want to finish the movement. But when I initiate the next movement, I go immediately into anterior pelvic tilt. Why? Because it's going to actually tighten up that muscle, because when I move down, the tension is going to be trying to pull my musculature into this rounded back position, right? And so if I go into anterior pelvic tilt to initiate a deadlift, I am actually pulling myself into a position where I've got further away to go before I run into this particular problem, right? So that's basically the fundamentals of what happens when you have a herniated disc in your back. And so, different things that you can kind of do about that. And this is advice that might get me in a little bit of trouble, but I'm going to give it to you anyways. So hanging, right? If you were to hold onto something above you and just let yourself hang and maybe do like a little bit of crunches, depending on how you're herniated, right? So if the disc is coming out this way, right? I need to open up space on the side that the disc is herniated out of, right? And so I might do, while hanging, a lateral flexion here to kind of loosen it up and let it kind of come back in, because there's connective tissue that's going to pull it back into a neutral position. Another way that you could do that, if I have a herniated disc on this side, is I can actually come here and I can stretch my hip down and into the wall, right? Which is going to open that up and relieve tension on that side so they can kind of slip back. Basically, you're going into the same position that allowed you to get into that place in the first place. Now, what if you got it wrong? Well, your body will let you know, because if you go the other direction, you're going to be pinching onto that pad and you're going to be pushing it further out into your nerves. What you need to do is you need to loosen up that tension. So either by hanging, you're allowing your body to decompress, and then by moving away from it, right, lifting the opposite side, you're hanging and creating space for it to come back in. Now, to talk about this a little bit more, what's going to happen if you get a herniated disc in your back, right? So your spine, each segment of your spine has about 13 degrees of rotation that it can do. It's not very much, and the reason why we can go further than 13 degrees here is because each segment has that little degree of movement, and I may have gotten that wrong. I think we actually cumulatively have like that 13 to 20 degrees of movement here, and that's coming from the cumulative amounts of rotation that our spine is allowed to do. So if you have a spinal injury, right, and what a doctor is going to tell you to do, they might, if you, and this is what I would recommend if you do have a herniated disc, is to ask to see a physical therapist first. That is your first course of action. Do not go to a chiropractor, right? Because the chiropractor is going to try to adjust, and if you have a herniated disc, I think that's going to be more of a contraindication for chiropractic therapy, right? If you have tightness in your spine, putting it back into a neutral position might release that tightness and make your spine feel balanced, so your muscles can relax and stop being overactive. So there is value to chiropractic, and I do have chiropractor myself. So I'm not being at all hypocritical here, but let's say that you do herniate your back, get a herniated disc in your back. You've seen the physical therapist, you've gone through everything that you possibly can, and it's still not getting better. What they're going to do is the next option is going to be surgery. And the reason why I want you to see a physical therapist first before going to have surgery is because not only are they going to put the spinal disc back into place when they do the surgery, and they have to be very careful about it, nerve damage is a possible risk of this surgery, right? But then they're going to go like this, and they're going to connect these two vertebrae. And so now, these vertebrae cannot move, right? And the problem with that is it's going to limit every direction that your spine can move, because now we have this. But if you think about that, right, if I want to curve my spine in a direction, right, I want to have this nice fluid arc, right? But if I have that plate in here, basically what's going to happen in that arc, right? So this is where the plate is, and it's causing this to not be able to bend here, right? And so what's going to happen is that you're going to have extra tension that's going to be put above and below that repair. And so the risk, especially because you're used to going through a certain range of motion, your body doesn't know at that point, once this is healed, that you are injured. There's going to be more risk in these 2 points of your spine that are going to have for herniated discs. So basically, when you're doing the surgery for a herniated disc, you are doing a last-ditch effort in order to get your body back to a non-painful, non-nerve damaging position. But the trade-off for that is you're losing range of motion, you're losing structure, and then you're creating points of further injury. So it's much better to not get the herniated disc in the first place, right? So you're always lifting properly. But the second part of that is that once you have this put in, you're going to lose that function, and you're going to be more apt to get injured. So that's my talk on core. We're going to get into chest and shoulders.